Welcome to In Other Words, the UCLA Tarjan Center's Plain Language podcast, where we interview our speakers from the Distinguished Lecture Series. I am Holly Oliver, the disability rights advocate at the UCLA Tarjan Center, and I will be your host for this episode. For more information, please visit our website, tarjancenter.org. It is spelled Tarjan center.org. I would like to welcome Dr. Yue Yu. Dr. Yu is a clinical psychologist. She offers evidence-based therapy to children, adolescents, and their families. Dr. Yu is also assistant professor of clinical psychiatry at UC Davis. Dr. Yu uses strength-based approach to work with individuals and their caregivers. She's an expert in cognitive behavioral therapy. She does diagnostic assessment for early autism intervention. Her research focuses on interventions for caregivers and children with autism. Before we start, thank you so much, Dr. Yu, for joining us today.
Thank you so much for having me today. It's wonderful to be here with you, Holly.
All right. As someone on the autism spectrum, early intervention and caregiver training has made a huge difference in my life. Your research focuses on engaging the caregivers. We all want to learn more about this important topic. Why should caregivers participate in treatment plans in early autism interventions?
That's a very good question. It is very important to involve caregivers in autism early intervention for young children. And in fact, caregiver-mediated early intervention is considered the best practice. So in this approach, caregiver-mediated early intervention approach, providers and professionals provide training and coaching to caregivers to use early intervention strategies during daily activities like playtime, meals, bath time, dressing. This allows children to receive more consistent learning opportunities outside of their formal therapy sessions. And this allows children to receive support across different daily activities and cross settings, not just in the therapy room, but also in their naturalistic environment. And caregivers play a critical role because they spend a lot of time with their child and can practice those skills repeatedly and kind of reinforcing that learning in the natural environment in everyday life. This approach also is consistent and support the family-centered care, which means families are not just observers of treatment or interventions, they're active participants, they're active members of the care team. They work with the providers to help make decisions, to set goals, and to support their child's development. The family-centered care is important because the families or parents really know their child best. They understand the child's strengths and challenges. They understand what their interests are. They understand how the family routine is structured and the cultural values in a way that providers may not necessarily understand. So by involving families as partners, the intervention goals are really more likely to reflect what matters to the family and fit into their lives. And also, this is supported by research that caregivers who are actively involved in early interventions and children tend to make more improvement in language communication skills and social skills. One more point to that is it does not only benefit children, also caregivers. Caregivers learn strategies to support the child's development. They feel more competent and confident in helping their child's development.
It sounds like this research supports caregivers for better outcomes. I know this is true for older children and adults because I participated in the UCLA Peers program, which required the caregivers and parents to be present to attend for the best results.
So they have a good understanding of what are the things that let's talk about in the group, so they can better understand the strategies and the support needed, and they can also help outside of sessions too.
Exactly. So, what are the barriers?
Caregivers may face many challenges that make it difficult for them to kind of consistently attend in early intervention sessions and assuming other interventions like you mentioned. There are practical and structural barriers, right? Caregivers need to get to the therapist office if it's in person, but they may not always have reliable transportation. Many interventions happen during business hours, and they may need to take time off from work, which may not always be possible. If there are other siblings in the family, they need to think about finding childcare. And also other competing demands, other responsibilities, right, that can make attending sessions challenging. Primary caregivers or parents may also be dealing with other additional stressors in life. That can be financial difficulties, that can be other mental health struggles they're experiencing, whether there are other family conflicts or other marital stress. If it's a multi-generational home, caregivers may need to take on that additional caregiving role of the senior family, of the senior member of the family. Um, Engagement can also be impacted by the relationship between the caregiver and the provider. When caregivers feel like they're not listened, they're not supported, or they're misunderstood by the therapist, they may be less likely to continue participating. If the intervention seems like does not meet the family's priorities or it feels like too demanding, the families may the caregiver may lose motivation to stay involved. So all those barriers can lead to missed sessions, reduced participation, and even just leaving the treatment altogether early.
Wow, I can see how all these things you mentioned, like transportation and attendance, can hold people back. How can caregivers help children after they get diagnosed?
Receiving a diagnosis is kind of a powerful process or a moment, right? Each family may react differently, feel differently. Receiving a diagnosis may bring a mix of feelings in the family. The family may experience relief, fear, uncertainty, feeling overwhelmed. These are all common reactions and it is normal to have all those feelings. They're part of the process. So I think it's important to emphasize that it's okay for caregivers to kind of take a minute to kind of process those feelings before feeling like, oh, they have to dive into actions or have to move on to the next step. That being said, it will be helpful to better understand the diagnosis. Caregivers could ask the diagnosing clinician about what the evaluation results mean specifically to their child. What are the child's strengths and challenges and recommendations? And kind of moving forward with treatment goals and pursuing services with both the kind of strengths and challenges in mind. When the child is first diagnosed, receive that first diagnosis, it's very likely that the parent will take on multiple roles, right? They will be the care coordinators, they probably will be the therapist, they're still the parent, and they probably taking on some teaching roles as well. And so thinking about how to build your own support team. Based on the child's needs, you may need a speech language pathologist, you may need an occupational therapist. If the child is diagnosed at a young age, you may need kind of early intervention services. If there are other co-occurring mental health concerns, you want to consider having a child psychiatrist or psychologist on that team. And you may need to kind of share that medical diagnosis with the school system, requesting evaluations from school or advocating for additional service or support. And also important to know that caregivers will need support for themselves. After the diagnosis, many families may feel overwhelmed by what to do next, overwhelmed by how to navigate the complex system. So connecting with other parents, join peer support programs or groups may help families kind of understand what services are available, helping reduce that stress and feel more confident kind of advocating for their child.
Well, these are all great tips for getting started. What is the caregiver focused approach?
Um, caregiver-focused approach is a way of designing and implementing a care services or intervention programs that actively centers and supports caregivers' needs and experiences. So the program may provide psychoeducation or social support to the caregivers. They may address psychosocial well-being of the caregivers. In the context of early intervention, we can just talk about rather than working only with the child, providers also coach caregivers and teach them strategies they can use during daily routines and in their interactions with the child. In the context of service access, one example is Mind the Gap program. So Mind the Gap is funded by Autism Intervention Research Network, behavioral health, AIRB. It aims to kind of bridge the gap between the new diagnosis and access to critical services. The program kind of addresses the challenges families often face. I mentioned earlier, understanding the diagnosis, navigating the complex healthcare system, psychoeducation, the educational system, kind of understanding available resources. The goal of Mind the Gap is to empower caregivers with the knowledge and skills needed to help their support their child.
Ah, that makes sense. How can peer navigators help?
So peer navigators are part of the Mind the Gap program. We can dive a little bit more into it. So when going back to the literature and talking to caregivers, when asked about their experiences in getting an autism diagnosis and accessing autism-related services, caregivers often shared that networking with other families, attending support groups, having informal meetings and calling other caregivers, kind of just sharing that knowledge and experiences were really helpful when the child and the family is going through that diagnostic process. The relationship with other peers are particularly helpful in keeping them kind of engaged in accessing care. So Mind the Gap, it's a multi-site studies, right? It's done in different states in the US. Was part of the UC Davis team. So in the Mind the Gap, caregivers are paired with a trained peer navigator based on language and location. So peer navigators are parents or primary caregivers who have already gone through the service system with their own child. They have prior lived experience navigating the system. So because they have this lived experience, they can help caregivers kind of understand the diagnosis, connect them to services and resources, help them understand how to navigate these complex systems. And also through the partnership and hopefully help them caregivers feel less isolated during this process. So to help support caregiver engagement in Mind the Gap, the peer navigators and caregivers kind of decide how they want to meet, whether that's in person or through Zoom or over the phone. During their initial session together, the peer navigator can meet with the caregiver and ask a series of questions. And through those questions, they kind of gather information about the child and the family. They gather information about child's strengths. What are the resources and support the family is currently receiving? And what are their needs? And kind of explore what are caregivers' priorities and what are their goals they want to achieve in their time together. The data shows that the families in the Mind the Gap really highlight this relationship with their peer navigator as the most helpful part of the program.
It's encouraging that peer navigators can help set goals based on shared experiences. I believe this will help both the caregivers and the children.
I agree. I think so.
Thank you. So, what is FANS EI, Family Friends Support in Other Health Interventions? And why is this a mobile program?
So we talk about so far the kind of the importance of caregiver involvement in early intervention, the barriers to their consistent participation and engagement. I was particularly interested in ways to support caregiver engagement in early interventions. And instead of focusing on the deficits and barriers, I want to ask, what do caregivers rely on already? What are the family's existing strengths and resources and skills that we can build on to support their engagement? So coming from this more strength-based perspective, and we know from talking to parents and caregivers that they rely on their families for support in childcare, house sitting, transportation, and or just encouragement and advice. And also, we know that social support is related to more the positive caregiver psychosocial outcomes. And through Mind the Gap, caregivers are paired with a peer who has similar experiences by the research team. What if instead of creating a new connection and we focus on the existing social support, the support system that's already in the family's life, such as a family member or a friend and neighbor or their community or cultural network, putting all that together and looking at the other health fields, it seems like this approach has been adopted in other health kind of literature or research area in terms of managing chronic disease and substance use and diabetes. One program is called Family Friend Network Support, FANS. It was designed to improve social support and self-care behaviors in low-income Latino patients with diabetes. So in that program, patients with diabetes can bring a family member or friend to join the program with them. And we're going to call them supporters. So the supporters kind of receive text messages from the research team, prompting them to provide social support. It could be providing support with tangible goods, items, or actions, or just remind the patient with diabetes about what are the healthy living habits or just emotional support. That program used the mobile health technology, primarily text messages, to kind of deliver that support and information and the messages. I think there are multiple benefits in using a mobile health approach. One, it's low cost, it's flexible, we all have easy access to. It allows folks to receive support regardless of where they are. We don't need to ask them to come in person to in-person social support groups. They don't need to attend in-person training whatsoever. And caregivers can choose a supporter even if this person is it's not close to them location-wise, live far away. So this makes that support more easy, accessible, and also it's easier to kind of scale to other families. And then we kind of took the FENS program, adapted the family friend network support to autism early intervention with our community partners.
Making a mobile program seems to work well to reach more people. It sounds fantastic. I did not know about this program at all before you mentioned it.
Yeah, I think it really increased the accessibility. And that's the hope that we can use this paradigm to see if could support caregiver engagement in early autism early intervention.
What is the focus of the program and how does it work?
The focus of FANS EI is to increase, obviously, caregiver engagement in autism early intervention. I think the unique part is through kind of building on or strengthening the social support from family and friends. So similar to the original FANS program, in FANS EI, caregivers choose a family member or friend to be their supporter and go through the program with them. And the caregiver, the supporter, and the early intervention provider meet together at the beginning of the program to discuss goals. Caregivers discuss their goals and supporters share their goals. And then both the caregivers and supporters will receive text messages several times a week. The text messages prompt the supporters to, similar to the original program, to provide practical support, can be practical support to the family. For example, we can ask the family whether they need help with organizing paperwork, they need help with childcare, they need help with pick up groceries. or reminders to use early intervention strategies that are in sessions, or emotional support, like encouragement, celebrate small wins, small successes, or self-care reminders. And the scholars also have some access to educational materials about autism, child early development. They can also choose to attend the intervention session if family agrees. So the overall goal is to build on the support that the family already has, and the hope is make it easier for caregivers to kind of stay engaged and helping children benefit more from the early intervention services.
I appreciate you sharing these positive outcomes of the program. I can see how this can help. What are the next steps for those of us who want to learn more, and what resources are available to help these families?
We are currently, for FanCI, we're currently in the recruitment phase and we're collecting data. We're recruiting early intervention providers and the families they work with. So hopefully we'll have more results and data to report back in a year or two. So stay tuned on the outcome of this program we're testing. In terms of resources, and so I mentioned Mind the Gap. Mind the Gap has a family resource binder that's housed under Live Binder. So if folks Google Mind the Gap Live Binder, they will find a list of resources in that platform. Includes for families, right? Including how to understand autism diagnosis, child communication development, early intervention system in California, other services that are available as well.
Those sound like great next steps. Thank you. You taught us that caregiver engagement is crucial for effective early autism intervention. We learned that strength based, community informed supports, such as the FANS, Family Friend Network Support mobile program, can lead to better outcomes for young autistic children and their families. FANS can build support, improve self monitoring behaviors, increase motivation, and strengthen relationships with caregivers. Thanks again, and see you all next time.